Hi, this is Amy Babcock, physical therapist, talking to you next about saddle position and how to ideally set that up and prevent injury. Okay, now that we've got the cleat dialed in, we're going to start working on the saddle adjustments. Saddle adjustments are basically up and down, forward, back, making sure the tilt is level, and choosing the right saddle for you, which could be the type of the saddle, width of the saddle, length of the saddle, and whether you want to cut out or not. Have a rider that is complaining of pain in their saddle area, the first thing you might want to do is raise their bars. In other words, decrease the drop from the saddle to the bars. You want to check to make sure that the saddle is level and not tilted up. You want to make sure the saddle has the correct width and fit. And if you do tend to ride in the drops a fair amount, a shorter length saddle might be more comfortable than a long nose saddle. I've had some cyclists tell me that they basically never ride down in the drops because it's uncomfortable. Quartering and descending can be a lot more accurate and safe if you can get down into your drops. Therefore, descending and cornering in your drops should be comfortable and accessible. It's important to note that the adjustments made at either the bars or the saddle are interrelated. Every adjustment affects something else and changes the angle. So if you raise the saddle, the bars are effectively lower. Conversely, if you lower the saddle, the bars are effectively higher. This can be measured from the trunk angle. The saddle does tilt forward and back. You want to ensure that the saddle is level. So to measure this, I often place a clipboard with a leveler on top of the saddle. If the saddle is tilting downward and the nose is down, then you tend to get more pressure and discomfort in the neck and shoulder area. If the nose of the saddle is pointed up, you can experience discomfort in the saddle region. This image just shows a quick check on how to ensure that your saddle is level. The width of the saddle is based on the cyclist's anatomy, or the width of the ischial tuberosity, also known as your sit bones. You can get measured at most bike shops to help determine the width of your sit bones, or ischial tuberosity. Sizing does vary from brand to brand. On a casual rider, you can have a 180 to 200 millimeter size. In more of a racing or road cyclist, saddle widths come in generally 143, 155, and 168 millimeters. Below you'll see a few examples of different types of saddles. The top left, bottom right are more for a recreational rider and made for more comfort and for a more upright positioning. The other three saddles allow for a more aerodynamic positions, for riding long distances, and for performance. You may have noticed in the last slide a couple of the saddles had cutouts. Cutouts can help ease pressure on sensitive areas, but for some, they can also cause irritation in the soft tissue. Some saddles offer a softer foam where the cutout would be, such as the specialized Mimic. The type of saddle that's going to be appropriate for the cyclist depends upon the type of riding they intend to do. The more upright, leisurely type of position a cyclist will assume, they're going to enjoy a wider saddle that has a little more padding for comfort. The more aggressive the position, the more aerodynamic the cyclist, likely you're going to have a more narrow saddle as well as a shorter nose saddle to accommodate for the shift forward. You can see on the image on the left, the cyclist is more upright, so their sit bones are going to be more evenly distributed over the back of the saddle, whereas the image on the far right, the individual is leaning quite a bit more forward and most of the weight shifts forward towards the nose of the saddle. When recommending saddle height, the following recommendations are based on more of a performance cyclist. BikeFit.com recommends 27 to 37 degrees. Other fitters have suggested 25 to 30 degrees. Jackie Lockwood suggests standardizing the measurement with the foot flat to 9 to 13 degrees. So the reason there's a variance in the above suggestions is partly because flexibility of clients can vary. Comfort is another factor to consider. Sometimes you may have injuries or areas of discomfort that need accommodation. But in general, you want a slight bend of the knee at the bottom of the pedal stroke. If you're able to perform a dynamic bike fit, you can adjust the saddle height while the cyclist is on the bike so they can Determine if position A or position B feels better. A goniometer is used to measure the knee angle. The top of the goniometer is placed in line with the greater trochanter, or the part of the hip that's most accessible and you can palpate. The bottom portion of the goniometer is lined up with the outside of the ankle or the lateral malleoli, and the axis is right at the knee joint. If you're performing a static bike fit, then you'll have to ask the cyclist to stop in order to measure the knee angle, unless you're using an app like Coach's Eye, where you can pause the video and measure the knee angle from the app. Once you've determined a new saddle height is necessary, make the adjustments, measure, and document. This is an example of capturing the knee angle from video. The app you decide to use should allow you to draw a fairly accurate line to determine the knee angle and also give you the measurement. And just to clarify, the angle we're talking about is depicted in the image below. The fore-aft of the saddle is the forward and backwards movement of the saddle on the x-axis. Keep in mind that moving the saddle up or down, as we previously adjusted, is also going to affect the fore-aft of the saddle. In other words, if you move the saddle up, it will move the saddle relatively back. If you move the saddle down, it will move the saddle relatively forward. Knee over pedal spindle is the measurement from the patella, or the kneecap, over the pedal spindle. The foot should be in the 3 o'clock position with the crank arms level, the shoe level. You can use a plumb bob or a laser. It's generally a good starting point. It doesn't need to be exactly precise, but should generally be within 2 centimeters forward or backwards of the pedal spindle. In this image, you can see that the cyclist has pretty good alignment of the knee over the pedal spindle. If the knee is too far forward or anterior of the pedal spindle, some cyclists may experience pain in the front of the knee. If you're too far back or behind the pedal axle, you lose some efficiency in your pedal stroke. Below are some general guidelines for setting up your saddle as it relates to injury or pain. If your saddle is too high or too far back, knee extension is increased, therefore possibly increasing stress on the hamstring or the iliotibial band. You may notice increased rocking of the pelvis that may strain the back. If the saddle is too low and too forward, generally this can increase in anterior knee pain and stress. If the tilt of the saddle is up, you'll get increased pressure and soreness in the saddle area. If the saddle tilt is down at all, you may increase stress on the neck and shoulders. Orthopedic doctors and physical therapists may recommend cycling for patients with knee pain, such as arthritis or a meniscus tear. However, cyclists can also experience pain in their knees from an improper position of the saddle or cleats. So below are some general guidelines for knee pain. Pain in the front of the knee, anterior knee, often we need to move the saddle up and back and internally rotate the foot to neutral if it's externally rotated. Pain in the back of the knee, we often need to move the saddle down and possibly forward. Pain on the inside of the knee or medial knee, we often need to move the foot in or the cleat out. And check for rotation of the cleat. We may need to internally rotate the cleat or turn the foot out slightly. Lateral knee pain or pain on the outer knee or iliotibial band area, we often need to move the foot out, same as moving the cleat in, or possibly lower the saddle. Tune in next for the last section on setting up your handlebars.